Hello, Northglenn. I am Mayor Meredith Leighty. Thank you for joining us this evening. Tonight, there are four of us to share information and take questions. City Manager Heather Geyer.
Good evening.
Fire Chief David Ramos.
Say hi, Chief.
Hi.
Welcome. Our Police Chief May could not join us this evening due to a family emergency, so we'd like to thank Commander Heidi Walts for filling in.
Hello.
If this is the first time you've joined us for a telephone town hall, here is a bit about how it works. We typically talk for a few minutes as the calls go out. Once we have everyone on the line, we take questions. If you are on the phone, simply hit *3 to ask a question. If you're listening to the live stream, there is an area to type a question. City Manager Geyer, would you like to say a few words?
Yes, thank you, Mayor. According to the state, the stay-at-home order will lift on April 26th. Then we will shift to a safer-at-home order, guidelines from Governor Polis, and quite a few businesses will reopen on May 1st, though there are still strict guidelines in place. At this point, we are following state guidance, but are also working with our neighboring communities, Adams County and Tri-County Health Department. There is a chance Northglenn may have stricter health orders than the rest of the state, and that would be a result of Tri-County Health Department issuing stricter guidelines. City of Northglenn buildings may remain closed until further notice. We know that the Recreation Center will be closed for the month of May. Sadly, all May events and activities and big events scheduled in June are also canceled. The dog park, skate park, pavilions, athletic courts, and playgrounds will remain closed until further notice. Parks and trails are open. Just make sure you wear a mask and use social distancing of 6 feet. And we are working on how to reopen city buildings at some point in the future, but will not do so until we have what we need in place to keep the public and employees safe. We will use a phased-in approach until we reach what we are calling our new normal. That means we will gradually add back programs and amenities as public health recommendations are lifted.
Thank you, Heather. There are definitely still some limitations. Our City Council will continue to hold virtual meetings throughout the month of May, since gatherings over 10 people are still not allowed. I'd like to give our Fire Chief a few minutes to talk about how COVID-19 is impacting North Metro Fire Rescue, and if he would like to share any particular information with our community.
Thank you, Mayor, and good evening again to everybody in Northglenn. It's a pleasure to be here with you tonight. I hope that you, your families are healthy and safe, practicing good safety practices at home. It's really important. I kind of want to begin first, before I talk about how we're doing, in giving a big thank you to everybody out there. It's amazing to us at the fire department how much you've reached out as a community to first responders to tell us that you appreciate us, and it's really meant a lot to the men and women that work in the fire service, the police departments as well, and that's been very important to us. So thank you for that. I guess I'd like to talk about how we're doing by saying, as an organization, COVID for North Metro Fire Rescue District, like it has for all of you who are under stay-at-home orders, it's kind of changed our world. It's been that way for everyone. So we've had to adapt a lot to the changing needs of our communities, to the risks associated with COVID. And I think the community probably already knows about a great deal of those risks. Having enough adequate PPE, and what's amazing to me most is that people in the community in general know what PPE is today, personal protective equipment, and that's an acronym that was usually only known by healthcare people, first responders, but now everybody knows what it is. And so things like essential face masks, the N95 masks, gowns, goggles, we've done a pretty good job being able to keep up with what we call our burn rate, what we use daily. having a supply that keeps us more than 30 days out, and in many cases 75 days out in front of this. We do get concerned that if a big surge hits, that might be challenging for us. So we've got a pretty large team that just works in logistics trying to cover that, but it's gone well for us so far. There's a lot of challenges adapting to this disease, not only to how to best treat it, but how to, protect not only our first responders from spread of the disease, but our next patients. So a lot of challenges associated with decontamination of a medic unit or an ambulance after we transport somebody. We have to make that unit safe for the next patient and safe for our employees. So we've had to do a lot of adapting, like most people in the first responder world, but it's gone well for us. I've been particularly proud of our people in the operations division, particularly our EMS people, our EMS chief, and its support staff that daily give updates to our crews on the ever-changing medical information that helps us to best address our patients' needs and take care of our community. And for us, that really is an ongoing start of a new shift, hour-and-a-half briefing. And it's been impressive to see how well the men and women of our organization have upped our capabilities to do well during this time. So I would have to say, the good news for us is that we've been able to keep up with the current call load. We've done well still with staffing our stations because we've been fortunate to have a fairly healthy workforce. We have had to quarantine first responders who have been in close contact with the disease, suspected COVID, while we're waiting to make sure they test positive and get out of that danger zone. But we've been able to support those employees well and get them back to work, and it hasn't been a big drag on our system so far. So I'm happy to report that I think we're doing well in managing the emergency response needs of our community up to this point in time. And we know we've got a lot of planning and a lot of work ahead of us to make sure that stays the case moving forward into the next coming months, maybe even a half a year. I think it's uncharted territory for all of us, and we'll kind of wait to see how this shakes out. But I think it's been mostly good news through these challenging times, with where we're at today.
Thank you, Chief. I really appreciate you being on this call. And for everyone who's waiting, Chief Ramos will stay on the call. So if you have a specific question, you can address that to him as well. Don't forget, we have quite a few people, a couple hundred, getting to, a little over 500 people on the call. If you're on the phone, simply hit *3 to ask a question. If you're listening to the live stream, there's an area to type a question. And in addition to myself, we have City Manager Geyer, Police Commander Walts, and as I mentioned, our Fire Chief, to answer some questions about COVID-19 and related issues in our community. So, Commander Walts, do you have any opening comments?
Yeah, first I just wanted to say thank you for having me here tonight. I'm sorry that Chief May couldn't be here. We're doing some of the same things that the fire department is doing, obviously, in that same kind of areas. Our highest priority is always keeping our residents and community safe, so we've been focusing on that, while making sure that we're keeping our officers safe as well, so that they can respond to your calls. We've changed our focus a little bit to be more in the neighborhoods and around our businesses, as opposed to out on some of the main roads. So you may not see them out on the main roads as much, but you will definitely see them out in the neighborhoods. I want to express really our appreciation to our community as well, because we've had an outpouring just like the fire department has from the community of support, and we've had Good Samaritans dropping off masks for us. We've had others that have sewn masks, donated materials, so that's been amazing. Hand sanitizer, everything to try to help keep the responders safe at the same time so that they can respond out to your guys' calls. We've been taking other precautions to make sure our staff is safe. We've implemented certain protocols for them with some shifts so that they're not overlapping, so that there's no cross-exposure there. Obviously, we're wearing our personal protective equipment as well when we come in contact with the public. We've got a new system in the Justice Center to be able to disinfect all the cars and the rooms, and we've actually been able to work with the fire department to get them to be able to have that availability as well to help clean out the fire trucks, the ambulances, making sure that we're getting everything cleaned out. We're also working on plans to kind of get back at some point to whatever that normal will be. So we're looking at how that's going to impact our shifts and where we're going to go from there. Other than that, we are still operating for the most part as normal. You guys, if you have your calls, you can call into the Adams County Communications Center to request police dispatch services. You can always call into the records department to talk to the records people if you have any just basic general questions. And we are always here for you if you need us. That's all I have, Mayor.
Thank you so much. I appreciate that update. And so we are ready to move to some questions now. So we're going to welcome Ruth. Ruth, are you there?
Yes, I am.
Hi. What is your question?
Hi. Well, I was wondering how many people have had the virus in our neighborhood.
So we have, first of all, for anyone who has that question, you can visit the Tri-County Health Department website. They update their case information for Adams County. They update it every day at 6 p.m. As of yesterday, there were 981 cases in Adams County and 57 cases in Northglenn.
Thank you very much for that information. I appreciate it, and I'm sure others do too. Thank you.
Well, thank you, Ruth. I appreciate you calling in. Okay, so we're looking at, just a reminder, *3 if you'd like to ask a question. So Trenton, are you ready?
Yes, ma'am.
Hi, what is your question?
Well, my thing was about Immaculate Heart of Mary.
Okay.
Is it shut down or is it open?
I believe, per the governor's order, that all of our religious institutions, churches, and places of worship are not holding in-person services. I'm not sure about the Immaculate Heart of Mary, if they are doing virtual services or not. I know quite a few of our places of worship are doing that. They're providing services online for people to watch. I wasn't quite sure what specifically you were asking. I don't know if I'm answering your question.
Well, my main thing was to see if they were open, because I went over there like 3 times. Normally on
they are still.
My prayer.
I believe the building is closed and will probably remain closed due to the governor's orders. However, they are running their food bank, so that's great. They're still doing community outreach, and we know people are still at the church and running the church. It's just unfortunately they can't be open to the public right now because of the health orders.
Okay, that was my whole question right there. I was just kind of wondering about it.
Okay, I appreciate you asking, and I would also look and see if they have information on their website. So maybe look for that and see they are probably helping their community with some specific details about programming and some other services that they're offering virtually. Thank you for calling, Trenton.
Thank you very much.
Okay, so we're still taking calls. Sorry for the hesitation there. So we're ready for Cheryl. Cheryl, are you there?
Yes, I am. Hello.
Hi.
I've lived in Northglenn almost 45 years in one house off of Irma Drive, and I'm very disappointed about this Carl's Farm Dairy Reimagined. I went to 2 ward meetings about it and protested, and 2 of my neighbors don't like it either. Why don't you just leave that as a nice prairie park? Why put in 3 types of homes with 3 kinds of levels of income, no garages? Because there are plenty of stores in Northglenn. There are 4 Walmarts within 3 miles. It is so sad that that's going to be torn up.
Cheryl, this is City Manager Heather Geyer. Thank you so much for your question. What I would offer to do, because tonight's discussion is really focused on our COVID-19 responses, I'm happy to talk with you tomorrow. If you have a pen and paper handy, I can give you my direct line at City Hall. And if you want to give me a call, and I will call you back if I don't pick up right away. I will be in first thing in the morning. So if you want to call me about 9 a.m., I should be available. Are you ready?
Yes.
My number is 303-450-8706. And I'd be more than happy to talk with you about the development and next steps and your concerns.
Okay. It's just sad. Thank you. Bye.
You're welcome.
Thanks, Cheryl. Okay, so if you are on the call, we've picked up a few more people, so thank you for calling in. If you are on the phone, simply hit that *3 to ask a question. And if you're listening to the live stream, there's an area that you can type your question. So we are ready for Lawrence. Lawrence, are you there?
Yes, I am.
Hi, what's your question?
With the latest studies on coming out of LA with these antibody tests showing that the infection rate is actually 28 to 55 times more, or 55 up to 55 more people, 55 times can be infected or are infected, which drops the fatality rate to that of the bad flu. With that in mind, when are we going to get to an actual normal instead of a new normal?
So, Lawrence, I think that's everyone's question. Every single person is desperately wanting the answer to that. We take our guidance from the Tri-County Health Department, and they are working very hard on all of those things. So there are studies all across the country that are, producing a varied amount of results. So we need to make sure that we are following the Tri-County Health Department direction and following our governor's direction. So as far as a new normal versus normal in the city of Northglenn, it's going to take some time, and it's as it has throughout this whole situation, it's rapidly changing, and we just need to adapt and be patient.
But if we're stopping based on some of these studies, actual religious freedoms, etc., are we actually closing these places like the gentleman before me who actually wanted to go to church, etc., based on these studies which are across the board?
I'm not quite sure I'm understanding your question.
You're saying you said yourself that these studies are across the board, where the latest studies which show antibodies, which prove and show that people not just showing sick signs, but actually have either previously had it or currently have it. With those latest tests, we are showing that this is drastically lowered. These are the latest tests released 2 days ago by the LA County Health Department. If those correlate to everywhere around the country, the significant death rate that we're all being told is lower. With that in mind, we're still following old antiquated tests of they show signs or we think they died of COVID. We're shutting down all these businesses. How fast can we restrict those? Because people are going, they're in food lines. People want to go worship. We went from having a very successful economy to now.
Yeah, Lawrence, I agree with you. People do want to get back to business. They want to get back to work. They want to get back to all of those activities that you're mentioning. As far as test results and, you know, what they mean, so you're citing a case out of California, we don't take our direction from that health department. We take our direction from the Tri-County Health Department. Unfortunately, tonight, our focus for the call was a little bit around public safety, and so the previous two town halls, we had a Tri-County Health Department representative. I would love to take your number and connect you with them, and that way you could have conversations about some of this information and hopefully get your question answered. As far as city decisions go, as I mentioned at the beginning, we take our direction from Tri-County Health. It is data-driven. So the governor is using, and the health departments are using very clear data to make their decisions. As far as what's coming out, what we've heard is, you know, it's going to take a really long time to get a vaccine, and the progress that other health departments are making is exciting, but we take our direction from Tri-County Health in Colorado. So I have your number, and I'm happy to follow up with you later and get you connected with people that can probably better answer your question. Would that be okay?
Sure.
Okay. Thank you for calling. Okay. So we have, really quickly, I'm going to turn this next question over to our city manager. There is a question about the progress on our movie theater, and so...
Hey, Bubble, have a bite, Mom.
Oh, I'm sorry. I didn't know.
Sorry, slight confusion. Megan, is that you?
It's me. I'm sorry. I was feeding my mom.
Oh, well, thank you, Megan. What is your question?
My question is very selfish. I have a new car. I need to get plates and get it registered, and I'm going to end up being late. So I will call the DMV and see if they're open, but am I going to get a big penalty for being late getting my car registered?
This is Commander Walts with the Police Department. I will let you know that they've given basically a grace period right now so that people can go in, and there's ways to do things online. Most of the Department of Motor Vehicles do have people answering the phones to help with some of those questions. They have some self-service kiosks. They're allowing mail-in online as well. So I think if you can just call, if you go to, I think it's mydmv.colorado.gov.
So what if I don't have a computer? Then what I should do?
Which county do you live in?
Adams. I live in Northglenn.
Okay. I'm just making sure. So, you know, your car, I'm just making sure.
Gotcha.
I can give you the phone number real quick that you can give them a call. They're there
That'd be
from
super.
8 a.m.
I'm ready.
to 1 p.m. Okay,
Yep.
It is 720.
720.
523. 6010.
And I guess just to finish off, how many of our first responders have gotten sick?
We've had 0 on the police department side.
That's very
we've been
exciting.
good, and I don't know.
That is really exciting. I support everything that we're doing. I don't think we should go fast. Until we have universal testing, there's no way for anybody to know anything. And so thank you very much for everything y'all are doing.
Thank you very much. I appreciate that.
Sure.
Fire Chief Ramos, did you want to answer that same question about first responders?
Absolutely. We've been very fortunate. We've had a lot of COVID scares, and a lot of times you don't know for sure if somebody's had the disease or not.
Right.
We do a lot of testing of our personnel, but so far we have yet to have one single person test positive out of 160 people. So we feel fortunate. We're doing well in that area, and we feel blessed.
Indeed. All right. Thank you so much.
Thank you.
Thank you for calling. So as a reminder, we've had a few more people join. So if you have a question, hit *3 and then it'll put you in our list of questions that are coming in. We have a couple of online questions, so I'm going to read them, and our city manager, Heather Geyer, can answer. So one of them is from Janelle. She's asking about the progress of our movie theater and if it's going to be delayed due to COVID.
Hi, Janelle. Heather Geyer here. Thanks for that great question. Things are continuing to move forward on the marketplace. HCP is the primary owner of the Northglenn Marketplace, and they are working with the city in developing their plans for that redevelopment project. As far as I know, and I received an update just earlier this week, things are moving forward and there's no impact by COVID-19.
Okay. And then another online question from Mary. She jumped on and was asking about our city-sponsored events. So City Council is looking very closely at our summer schedule. We love to celebrate as a community, and we love our events. We need to be really careful based on the guidance from the governor at this time. So any events that we would have had in May are not taking place, and most of our large events in June are also not taking place. At this point, we're trying to look, I think we decided 6 weeks out to see if an event is 6 weeks away, that's when we're going to make that determination. We are also going to be collaborating with our regional partners, so other cities and counties that are near us and in the metro area, to make sure that we're all making, safe decisions for our residents. So I hope that helped you better understand that piece. So now we're going to go back to the phone calls. Let's see here. We are going with Rich. Rich, are you there?
Yes, can you hear me?
I can. Welcome.
Great. Madam Mayor or anybody else on the call, I was just wondering if you can answer whether this phased approach is going to be driven or informed by testing. And if that is the case, what are the protocols or options available for citizens to receive testing?
That is a great question. I think it's also an area that we are learning more about. So based on the governor's guidelines right now, he's provided guidelines about the 6-foot separation when possible, no group sizes larger than 10. Those guidelines have been put in place because the healthcare industry is working on getting us equipped with testing. Some guidelines include that employers can start doing temperature testing to make sure that employees do not come to work sick. As the governor said today, employees who feel sick need to stay home. They do not need to go to work. And so part of what we're going to learn more about as we move forward is when more testing becomes available. Currently, testing is available through healthcare providers, but we don't have any guidance right now in terms of whether or not there'll be increased testing aside from if you are symptomatic and if your doctor decides to have you tested based on what symptoms you display. So there's more to come on that front. There has been progress made. We know that National Jewish Health is offering antibody testing without a physician referral, and an appointment can be made through National Jewish, and that test is $94. That can be made online, both the appointment and the payment. There's a blood draw test that will be taken at their drive-through testing tent between 13th and 14th Avenue on Harrison Street in the National Jewish parking lot, and appointments are available 7 days a week, Friday, April 24th through April 26th has been sold out, so you would have to be looking at a date after that time period. But details can be found about that antibody test on their website. So you can either go through your physician if you're symptomatic. I do know that physicians, it is their call as to whether or not they test you, but if you want to get an antibody test, you can go through National Jewish Health. Did that answer your question? Yeah.
Yeah, I do have a follow-up. This is more maybe a selfish question, but will dental services also be opened, or is that going to stay closed for now? Say I have a dental appointment mid-May, for example.
Oh, good, because I had a dental appointment in April and it got canceled as appropriately. So dental providers are going to need to take extra precautionary steps with PPE. And so I imagine your dental provider is going to be reaching out to you and letting you know what things you need to know in advance of your appointment. And certainly I know from other industries that they will ask individuals if you are sick to not come in for your appointment. That's the first set of criteria that needs to be complied with. And so your dental office should reach out to you, but feel free to reach out to them in advance. But dental offices are reopening.
Got it. Thank you. Appreciate that.
Mm-hmm.
Thank
You're
you,
welcome.
Thank you for participating. So I have another online question from Steve. I think Steve has the question that we all want to know the answer to, and it was, do we have any plans for the 4th of July fireworks? We do not at this time. We are going to be collaborating with our regional fire departments and police departments and cities and counties and making that determination together. Unfortunately, that is one of our most popular events, and it brings in quite the crowd, and so we would have a really hard time with the social distancing and that's definitely a group of more than 10 people. So depending on how things play out, as I mentioned earlier, City Council is looking at events that are 6 weeks out. So when we get closer, we will be able to make that determination, and we will communicate with all of our residents. And so I just want to put a quick plug in here for communication. We're really thankful that everyone is participating in this telephone town hall, but just a reminder that you can stream our City Council meetings that are on Mondays. We have a website that has a ton of information. We have different social media, Twitter, Instagram, Facebook, where we put a lot of information. So make sure that you're tuning into that. And then I just want to thank Sharon for the compliment. She is very thankful that we do keep everyone updated. So we do have our resident safety at the forefront of our minds, and it is a challenge, and we appreciate your support, Sharon. Okay, so next question, we're going to go to Nancy.
Hello.
Nancy, are you there?
I am here. How are you?
Hi, good. How are you?
Doing well. I have a question. I'm not sure if you're allowed to answer it because of privacy issues or not. My question is this. Are we allowed to know the general vicinity where those 67 COVID cases are located within Northglenn?
On the Tri-County Health, we can't tell you from memory, but on the Tri-County Health Department website, they do have it broken down by neighborhood. So when you look up, it starts at the county level, goes by the city level, and then if you scroll down to the lower part of the page, they just started showing neighborhoods. That's as detailed as they can get without violating privacy. So although we know that there are 57 cases in Northglenn, you can get a further breakdown on the Tri-County Health Department website. So it's tchd.org/coronavirus. They have all of their reports there and break it down a little bit more.
Excellent. Thank you so much. I appreciate that.
Thank you. And yes, the Tri-County Health Department website and their COVID-19 data, it has been evolving, and so that was a recent addition. So definitely go back and look at it. Okay, so let me see here. Another online question is about, are there shortages of food or medicine or gas? And so really quickly, we just want to reassure everyone that there are not any shortages. So we participate in regional, state, and federal briefings and have been reassured that there are no shortages in the supply chains for food, medicine, or gas. So that is a question that a lot of our residents have. And also kind of a follow-up to that is a connected question about, is our water safe? And yes, it is. Our water is safe to drink. We're meeting all the regulations set forward by the state and the EPA. And I think our water is delicious anyway. So yes, it is safe, and all of our essential services are up and running as well. So, the city is doing its best to maintain a safe environment for our employees and still provide the essential services to our residents. So thank you for asking those questions. All right, we're going to go back to the phones. And just a reminder, we have plenty of time set aside. So if you have a question, hit *3 and you can be added to our queue. So we're ready for Linda.
Yes, I'm here.
Hi, thanks for calling. What's your question?
Oh, I was just wondering, I'm a senior citizen, and I was just wondering, I'm not allowed to drive. Anyway, I was wondering where the closest places in Northglenn would be to go and get the test.
Actually, we have this information written up, so forgive me for reading it, but I am just going to read it.
Okay.
There are no testing sites in Northglenn if you're just getting a test because you want to get a test. If you just want to get a test on your own without a physician order, there is not one in Northglenn.
Okay.
If you want a test in Northglenn, it has to be physician ordered. If you want to go out and get a test on your own, the closest places are advanced urgent care, and there are advanced urgent cares in Brighton, Stapleton, Lafayette, and Broomfield. So advanced urgent care, Brighton, Stapleton, Lafayette, and Broomfield. And then there's also the National Jewish Health one, which is in Denver, where you can get the antibody test. So those are the closest testing places that we are aware of that you do not need a doctor's order. You can just go get it on your own.
Okay. Thank you very much.
Thanks for calling, Linda.
Uh-huh.
Okay, so we actually are out of phone calls. We have a couple more that have come in on the web and so on the internet, so we will answer those really quickly. But just a reminder, if you want to ask a question, *3, we are available. So this is a question that's come up a couple of times. Tara's asking about increasing the number of chickens we can have. So I'm going to let City Manager Geyer answer this one.
Thank you, Mayor. Currently, the city is not considering increasing or changing our requirement of the allowable number of chickens that you can have. Currently, our regulation allows for no more than 6 chickens per permitted yard. So it is a permitted process, and what I would recommend is if you feel strongly about this increase, that you reach out to your city council members, send the mayor or myself a letter, and I can certainly share that with city council. But we have, I think you're the second person that has asked this question. I think we got this similar question at our last telephone town hall meeting, but we haven't seen an overwhelming response in terms of interest, rather to change the permitted process as it's written right now.
Okay, so we have another internet question from Janelle. She's asking about fireworks, that she's starting to hear them again and thought they were illegal. Yes, Commander Walts.
Thank you, Mayor. Yes, we do have a municipal ordinance for personal fireworks, and they are illegal. Anyone caught using them can face a fine. Home and property owners also can be cited if they're in possession of them. So, yes, personal fireworks are illegal, but the government-sponsored ones are not. So if you're hearing them and you want us to come out and see it, please call in to ADCOM and we'll send an officer out and check on it for you.
I would like to add that the minimum fine in Northglenn has been changed recently. So the minimum fine for fireworks is $1,000. So you really don't want to use home fireworks. It's probably not worth it. Chief Ramos, do you want to weigh in for fireworks at all?
Probably that I support the municipal code. Home fireworks are absolutely been a big cause of fires in our district, and so we support that municipal code and really encourage people to not use home fireworks. A lot of injuries outside of just fires that occur in that area, and so it's something that we think is important to enforce.
And if you do have any fireworks going off in your neighborhood, I ask you to call the non-emergency number up at ADCOM, and their number is 303-288-1535. Again, 303-288-1535.
Yes, we're going to go back to the phone. Thank you for putting the questions in. So we're ready for Kathy. Kathy, are you ready?
I am. How are you?
Good. How are you? Thanks for calling in.
Thank you for doing the phone call meetings. I think they're great. I've listened to you all the time, and they're very informative. So I thank all your panel for being there for us tonight.
Awesome. What's your question?
My question is, in our neighborhood, I'm noticing signs up in people's yards that have a big heart on them, and it says, "We're in this together." Where do you get those, and how do you, and, you know, like, is there a fee for them, and how do you get them put in your yard?
That is such a great question. I'm glad you brought it up. So this is a promotion. There are Northglenn Hug Signs.
Yeah.
And it was such a popular thing that we ran out. But we're getting more, so that's the good news. It's a really cool program. You can request a yard sign and send it to a neighbor. If you really want one, you can get one. All you need to do is call and give us the address. The houses must be in Northglenn, and we limit one sign per yard. So if you have a pencil, I will give you the phone number because you can leave the address on a voicemail.
Okay. I'm ready.
Okay. Awesome. So you can call 303 450 8904.
Great, I will do that.
I love it. And we've had some residents that will also, you know, when they receive a sign, they'll enjoy it. They'll take some pictures with it. They'll keep it for a couple of days, and then they pass it on to a neighbor. And so we're able to spread the love and share the joy. So I'm really glad you asked about that. So make sure you give that number a call.
I will. Thank you. I just think it's such a neat promotion, and I know our community's really liking it. So it's just great. I love it.
Oh, yeah, and it is free.
Okay. Thank you so much. I appreciate your time.
You're welcome. Thanks, Kathy.
Have a good night. Bye-bye.
There goes Sandy. All right, we are going to Sandy. Sandy, are you on the line?
Yes, I am.
Hi. What is
thank
your
you.
question?
Well, I want to thank you first off. This is our mayor, right?
Yes.
Okay. Nice to talk with you. You're fairly new, and so I do appreciate the two-way conversation, and I would love to see that continue. Anyway, the point I wanted to make regarding COVID is there is a worldwide movement. I'm not sure if you're aware of it, to go out at 8 o'clock at night in honor of all of our first responders, hospital workers, food service people, firemen, policemen, all of the delivery people that are keeping our nation afloat right now, to go out in honor of them at 8 o'clock at night and ring bells, bang pots and pans, hoot and holler, and express your appreciation. I'm just wondering if you were aware of that and if you guys are in support of that, because I have heard a lot of that, and I think that's where the firework question is coming from. Not that I condone fireworks.
Sandy, I appreciate you elevating that because, number one, I do support that, me personally. Our city council also has kind of a, I don't know, low-key competition going. Which ward can be louder than the other? We've had a few challenges between us in just all in good fun because we do support exactly what you're talking about because it is in celebration and honor of our first responders and our essential workers, and it's fun. It also helps you feel not so alone when you are kind of feeling alone at home. So we go outside at 8 o'clock, my family, and we do the howling. That's what we have chosen to do. And when you hear someone across the block, across the neighborhood, responding, it helps build community. So I think it's a great idea, and I'm glad you brought it up, so that way the rest of our callers can hear about it and join in too. Anyone else on the panel joining us at 8 o'clock?
Yes, absolutely, Mayor.
Absolutely.
Chief Ramos, are your guys hearing it while they're out and about?
I'm sorry, say that one more time. What about the out and about?
Are your firefighters hearing the 8 o'clock howl?
Absolutely, and they love it. I love it myself. I love going out on my back deck and listening to the neighborhood when it kind of comes alive at 8 o'clock. And I think it means a lot, not just support of community workers, and for me, support of those hospital workers right now. I mean, they really bear the brunt of this, along with other first responders. But I love the sense of community that was expressed. I think it feels meaningful to me. It makes us feel like we're all in this together. And so we love it. Our people in the street love it. And I like the noise.
Thanks, Chief.
Great.
Awesome. Me too. Thanks, Sandy. Have a good night.
You too. Thank you very much for having the call.
Okay. So we are going to go to another call. Jason, are you ready?
I'm ready. My question was
Hi.
regarding the revenue loss and tax loss that the city will be experiencing right now, and what the city's doing to prepare, and if they're anticipating having to reduce any services.
Thank you. I'm going to have our city manager answer this. This was a hot topic at council on Monday, and we do have a plan. Heather?
Thank you, Mayor. And thank you for the question. As Mayor Leighty indicated, City Council had a very robust discussion Monday night about our financial position. I'm pleased to say that the city is situated well financially thanks to the decisions of past council members, mayors, and our current elected body. The city has a healthy reserve balance that helps in times like this when you need to weather the storm, so to speak. On Monday evening, our finance director and myself, we presented 3 options to City Council and recommended options for potential financial impact that do not include a reduction in service to the residents. So right now we're in a period of time where we don't have good data, and taxes were due to the city on April 20th. Our staff will be in finance will be working through what that revenue looks like for essentially half of a month of March impact. As we move into late May, we'll have good data for April. And so basically the thing to keep in mind is the sooner that businesses are able to reopen, the better from a sales tax revenue perspective. In talking with my finance director today, we're seeing some interesting shifts. So while you haven't been able to make in-person transactions with certain retailers here in the city, we've seen increases on the online front. So it's too soon to tell right now what the actual impact of COVID-19 has had on the city of Northglenn. But I would encourage you, if you're interested in taking a look at the council packet from Monday evening. Council's direction to me was to continue to be cautious and conservative and plan for what we're calling the high impact scenario, which I guess you could say is more of the worst case scenario, and that's about a 17% revenue decrease by year end. Again, this is a timing thing, and we have to take it day by day and month by month, and as we get better data, we are going to be refining this high impact scenario. But at this point, the mayor mentioned earlier, we're continuing essential services. So I'm hopeful that we can stay on this path and that we do not get to a point where we have to recommend any type of service reduction to our citizens. And that, I can't express this enough, is due to the great decision making of our current elected body, our mayor and city council members, and their conservatism when it comes to financial decision making, and that of past mayors and city councils here in Northglenn. And happy to answer any follow-up questions you might have.
Thank you for that very thorough response, and I want to echo thanks to all of the frontline people out there serving the community.
Thank you.
Thank you, Jason.
Thanks.
That's a great
Yeah,
question.
thanks.
All right, have a good night. So we're going to move to Sandy on the call. Sandy, are you there? Oh, hold on a second. Are you there now, Sandy?
Yes, I am.
Hi, what is your question?
My question is, you have a plan through the Northglenn Police Department for people who are over the age of 65 to get them their medications. I am disabled and immune compromised, and I'm only 60. Is there anything that you would have for people my age?
You know, Sandy, if you want to participate in the program, we'd be more than happy to have you do that. So we do have the program. What you'll need to do is we have 4 participating pharmacies that are in Northglenn. So we have the King Soopers, Walgreens, Safeway, and Walmart. You'll need to call in first to them and arrange for the prescription that you want and pay for it. Then you'll call into our records department, and I'll give you that phone number here in a minute. They'll take down your information, and then we deliver the prescriptions on Tuesdays and Thursdays between 10 a.m. and 4 p.m. You'll need to make sure that you're there and with the ID so that we can make sure it's you, and then we can deliver that. Now, the one caveat I do want to put is there are some prescriptions that the pharmacy won't release to us to deliver, so you have to make sure it's there. But if you want to participate in this, I'll make sure that you're included on our list. So, okay. Are you ready to copy the phone number?
Yes, ma'am.
It's 303-450-8893. And just call into the records department, give them your information, let them know that Commander Walts told you to call in, and we'll get you taken care of.
Thank you so much.
You're welcome, and thank you.
All right, next caller. Once again, we still have time. We have a few more minutes, so if you have more questions, *3 to ask a question. So we're ready for Christina.
Hello.
Hi, what is your question?
I just had a question. After everything, opens up a little more and stuff, are you going to allow us to have yard sales in the neighborhood?
So technically, I would say yes. However, we need to maintain the 10-person rule or guideline that is in place right now. I think my bigger question would be if people would come, because we do have some residents that are very cautious still, and I would want residents to also be cautious about what germs they're allowing in their front yard for a full day. So I would say yes, with caution. That could put you at risk. I don't know. What are your thoughts on that?
Okay. No, that's understandable because I mean, I'm still cautious myself, but I'm just like wondering, like later on as it starts to get nicer and things open up more, like not right now or anything, of course, but later on, like in a couple months or so.
Yeah, it's a great question because we do have quite a few every summer. You know, those are really fun Saturdays to get out and about. So I would say we're going to elevate that as a group and talk more about it officially as a city because that hasn't been something that we have tackled as an issue. So I appreciate you raising it up and then look for some communication and we'll provide some clarity around that for you.
All right, that'll work. Thank you so much, and I appreciate everything that everybody's doing.
Oh, thank you.
Okay.
Have a good night. Okay, next caller, we're ready for Cody. Cody, are you there?
Yeah, I'm here.
Hi, Cody. What's your question?
Yeah, well, with everybody being off work and, schools being out, I'm a resident of the Webster Lake area on the east side of the lake, and we've seen an increase in some street racers over here. And I've seen it a couple of times that some kids are coming down the hill, and cars are blasting through the parking lot on the east side of the lake. And I was wondering if there's a possibility that there could be maybe a speed bump put in for some of these cars that are coming through our neighborhood and then coming out by the skate park down 118th at, big speeds, high rates of speed. And, it's just, like a question that's being raised in my neighborhood with my neighbors. And we were just wondering if we could get some help just to make sure nobody gets hurt.
Cody, this is City Manager Geyer. That's a great question, and we do typically see this type of undesirable behavior when the weather's getting nicer, people are out later in the evenings. So a couple of things for you to consider. Commander Walts is listening and on the call, and so she can let patrol know that the area you described is having increased issues with speeding vehicles, and so that way we can have officers go over when available and do increased patrol in the area. We can also look at having our speed trailers put out. That's different than radar. A speed trailer is, if you can visualize the small little trailer where the speed flashes at you as you're approaching the trailer, and that's used to really educate and make motorists aware of what speed they're actually traveling at. So we can do that in the short term. The speed hump that you talked about, that's more of a longer term solution, and we are launching our No Need for Speed program on May 1st. And so the last Connection newsletter had a ton of information about this new program, so I'll try to provide you with the highlights. There should be a page on our city website where you can reach out to engineering and request that a speed study be done for your neighborhood. And that will start a process where we will put speed radars out, and that technology is such that if you have in the past seen the tubes that have been laid across a roadway, and then as cars go by across those tubes, we collect data on the speed. Well, now there's radar technology, and so we would strategically put the radar technology out in the neighborhood along the street that's experiencing the issue and collect data to see if the speeds trigger a need for a physical modification to the roadway, such as the addition of a speed hump. And so that's a process that would take place over several months, but it's part of our No Need for Speed program that's launching on May 1st. So if do you have access to the city website? Do you have internet access?
I do.
Okay, so go ahead and jump on the city website, and you can either type in "no need for speed" in the search function, or go to the Public Works webpage, and you can find out more information about the program there. And the other thing that we're doing along with "no need for speed" is there will be situations where, after doing the speed study, that it's a physical modification, such as the addition of a speed hump or other improvements, aren't warranted. So we are really encouraging neighborhoods to come together and increase the level of awareness around speeding and the negative impacts that it has on quality of life for residents living in neighborhoods. And so we have a signage program where we will install "no need for speed" signage in a neighborhood. And this requires involvement from more than just you in your neighborhood, but it's a great way for you and your neighbors to band together and really say this isn't going to be tolerated. And so that's one additional aspect of the "no need for speed" program, and all that information is accessible on the website.
Thank you, Heather.
Awesome. Thank you.
You're
Thanks
welcome
for calling, Cody.
So, Mayor, if I could jump in briefly, I'm the Communications Director, and we're going to be wrapping up this call in a moment, but I did want to let you know, if we did not get to your question, we do all the questions and answers, whether they were answered or not, on the phone, on our website, which is www.northglenn.org/virtual-town-hall. So give us a day or so, and we'll write them all up and have all the answers there. Some people we just ran out of time. A couple of others we really just didn't have the answer. So please go and check out the website tomorrow late, and you'll have all the questions and answers there. Thank you, Mayor.
Thank you, Diana. Okay, so I just want to thank all of our participants and all of our residents for joining us, but I also want to extend my appreciation for Chief Ramos joining us. Thank you, Chief, for being here tonight.
You're welcome. Thank you for having me.
It was good to talk to you. We will talk to you soon. And also thank you to Commander Walts for joining us.
Thank you, Mary. I really appreciate it.
And we also have, obviously, our City Manager, Communications Director, our assistant to the, what is her official title?
Assistant
to the City Manager. That's what I thought. Sorry, Rupa, I should know that. So we do have a small crew tonight for this town hall. We are hearing that you appreciate them, that you like this form of communication. We have, we're still using all of our other communications channels, so don't forget to read The Connection every month, use our email, use our website, connect with us on social media. These telephone town halls, we will have another one in 2 weeks, and hopefully we will be able to invite a few council members to join the call, depending on the restrictions at that time. We want to keep our numbers down. They are always welcome to join us on the phone, so quite a few of them are probably listening in, and we appreciate their work. But we are wrapping up, so I just want to thank everyone, but just a quick reminder, the stay-at-home order has been or will be changing on Monday to the safer at home guidelines, and that means that we need to continue to stay home as much as possible. And if you go out, you want to wear a mask when you're out. You want to continue to wash your hands and be safe and healthy and limit your gatherings. And so just to remember that, you know, we're not through it yet, but we are all standing together, and we appreciate your help. So good night, and we hope to talk to you soon.